Welcome to OncoPharm. I'm your host, John Bazar. I am a professor of pharmacy practice at the ETSU Bill Gatton College of Pharmacy, and today we continue our mini-series on pathways to becoming an oncology pharmacist. I am pleased to be joined with Kayla Fry, who is, quote, according to her employer, a patient care pharmacist. Welcome, Kayla.
Hello, thanks for having me.
And Amber Burgess, who, according to her employer, is a clinic oncology pharmacy specialist. Welcome, Amber.
Hello, thank you.
And so Amber, I know a little bit about your training, right? So you are one of the esteemed alumna of the ETSU Bill Gatton College of Pharmacy. And why don't you tell our listeners what you did after pharmacy school?
Yes, so after I graduated pharmacy school in 2021, I went over to Fayetteville, North Carolina, where I completed an ambulatory care-based PGY1 residency. And with that, I was able to complete an elective rotation in oncology in January of my residency year. But unfortunately, that was after I had already submitted PGY2 application. So it was a little bit late to pursue a PGY2 in oncology. And then I went on to Orlando, Florida for a PGY2 in ambulatory care. After that, my husband's job brought us to Kentucky. So I've been in Lexington, Kentucky since 2023. And I've been working in oncology kind of in a roundabout way since.
Okay, all right. Kayla, what about you?
Well, I graduated from the University of Kentucky in 2018. I did my PGY-1 at the Christ Hospital in Cincinnati. And then I am from Ohio, so that was a little bit of my draw back to Ohio, was getting to Cincinnati, doing residency there. I actually, similar to Amber, but not. I was planned to do an elective oncology in my PGY1 year, and actually traded that out last minute for a second month of ICU. I do have regrets about that, but needless to say, I did not go on to do a PGY2. And so when I was at the Christ Hospital, I got hired on after there. I was working there, and I got the opportunity to go down into our cancer center, to our oncology satellite pharmacy. And that is where I got my first experience with oncology. And then now, so I took the current role that I have now in July of 2022. And it is essentially a new position, new medical oncology clinic, new everything. And so it has been a whirlwind and quite the learning experience, but it's been also one of the most rewarding parts of my career.
So right after residency, you did a job at the hospital where you worked as like a
Mhm.
decentralized clinical pharmacist?
I was actually just a fully inpatient staff pharmacist.
Okay. Okay. So it's a
Yeah,
small
yeah,
pharmacy.
it was definitely staff pharmacist and then clinical specialist at that
Okay.
hospital. Yep.
So your primary role was like order verification,
Yep.
dispense. Okay. And then you get some experience in the oncology part of that. Was that your first exposure to oncology patient care, or did you do a rotation as a student?
So I did do a rotation as a student. I actually did it with Megan May, she's at Baptist Health Lexington, where Amber is right now. And she's wonderful. And so I did get a taste of oncology in my fourth year of pharmacy school and Appies, but I left it loving it. I really enjoyed the rotation, but at that point, I think I just had the mindset that I wanted to be more general. And so, yeah, I didn't have it in my mind after that I wanted to be in oncology for whatever reason. So, funny
Okay.
way of
Yeah.
landing here still, but
And Amber, I don't think you did an oncology rotation as a student, did you?
I did not. So I went through fourth year rotations during COVID. So a lot of our initially in person rotations did end up getting switched to something else. So I did not complete one during pharmacy school.
Okay. Did you have one planned and it got canceled? Because
I
that was at the
believe
end of the
so.
year, right? Yeah.
I believe so. So I think that I had one, and I don't think it was with you at JCMC. I think it was at another location or with a
Okay.
different preceptor, but it did get
Yep.
switched, unfortunately.
So so neither of you had dead set plans that you wanted to be oncology pharmacists. You knew you wanted to do residency training though. So let's talk about that decision point. So Kayla, you knew you wanted to do a residency. What was it that said, all right, I know I want to do a residency. I'm not maybe sure what I want to do. What was your thought process in pursuing PGY1?
Yeah, great question. So I actually flipped around a little bit in pharmacy school. Going into pharmacy school, I was like, I want to be in an independent community pharmacy, like run my own independent pharmacy. So I definitely switched quite a lot. But
So many
towards the
people,
end
so
of
many students have that entry point to pharmacy school, I
yeah,
see.
yeah. Somewhere along, the midpoint of pharmacy school, I realized that I wanted to be in the hospital setting. I, learned through a lot of different teachers and others that, residency was the way to go. Obviously, that's when it kind of starts to come in and they teach you all about residency. Um, so I knew that going towards a hospital setting and being in that meant I needed to do a PGY1 to strengthen skills. Um, I just knew that 4 years of pharmacy school and the last year of APPES was not going to prepare enough for where I wanted to be in the hospital setting. And yeah, I was very general coming out of school. I did not have a specialty that I was dead set on by any means.
Okay. And Amber, if memory serves me correctly, you were sort of thinking AM care specialist all along, right? And so what
Yes.
and so what was it about that oncology rotation you had, in the second half of your PGY1 year that that changed you?
So it truly changed everything for me. My preceptor, she had just completed residency at the same institution the year prior. She was the first pharmacist within that clinic setting. She kind of started everything from the ground up. And I just got to see the impact that she had on those patients in North Carolina, her heart, her caring. And my mom, she was diagnosed with metastatic breast cancer back in freshman year of my high school. And so just seeing what my mom went through, I think I've always kind of had that heart, had that passion for patients going through cancer. But it was something that kind of scared me a little bit. I didn't know if I wanted my full career to be centered around that, but that residency experience in PGY1, that was really impactful.
Okay. Well, we had a little Wi-Fi glitch here. And so as I think when we cut out um Amber, you were talking about your rotation you did in your PJ1 year and how wonderful the pharmacist was who had just finished residency in their clinic and how, to maybe paraphrase, how much you saw that one could do as an oncology pharmacist, and you thought you wanted to maybe do that, but you said you weren't sure. And I asked, were you afraid of the emotional toll of that, or was it more fear of all you would have to learn and all the dangerous drugs, or some combination of the two?
That's a great question. So I do think some form of a combination of those two, oncology can be daunting, definitely, but I think it was more so the emotional toll, the emotional impact. I think with my mom's diagnosis, her living with metastatic breast cancer since 2012, it's one of those things that kind of sits in the back of your mind at any moment. You try to just go through and live your life to the fullest, but it is kind of scary, and kind of thinking about taking that emotional toll and emotional burden on for my patients as well. That was scary too, but something that I eventually felt was definitely worth it.
Yeah, and so when you decide to pursue oncology as like or oncology pharmacy as your career, you reach out to me and I gave you some
Yes.
advice about things to consider. So what did you do then to kind of get your foot in the door as a clinic on your way to a clinic oncology pharmacy specialist?
Yes. So there was a job opening. I hadn't been in Kentucky very long at all. And I saw a job opening for a smaller cancer center. They were looking for an oncology pharmacist to kind of start pharmacy services there at their two smaller cancer, their oncology clinics. And so I ended up getting that job as the first oncology pharmacist there. And so it was kind of even more daunting because I was trying to create order set templates for that clinic. They initially had their physician assistants pinning all of the chemotherapy orders for the oncologist. And so they kind of had me revamp that. So I did a lot of scanning through all of the NCCN order set templates, utilized NCCN guidelines, NCCN patient guidelines. So really tried to kind of go back to the basics in a sense of get all of their chemotherapy order set templates ready to go. And then also we were an affiliate of UK at that first cancer center that I worked at. So I tried to utilize those resources as well through the University of Kentucky. I did some shadowing. And they also had a pharmacist who was willing to meet with me virtually, kind of provide some mentorship as well. So really anything I could do to get some more resources, some more knowledge, I really tried to do.
So this was mostly sweat equity, sounds like that you did.
Yes, yes.
You didn't go through any of the like ASHP as a certificate program. Now, I don't think they did then, or HOPA's core competency or any of the board certification courses. This was just Amber reading, learning, figuring out as you go.
That's right. I did a lot of reading. I did probably 4 months into that job, I did get the HOPA certification course in terms of going through those different, I think they have 12 different modules. So I was able to download all of those, and that was a great resource as well.
Okay, so the core competency program. Okay. What about you, Kayla? When you decide, all right, I'm going to be an oncology pharmacist, what was your approach then to kind of get the skills, knowledge, et cetera, that you needed to do this?
Yeah. So at my prior place of work, where I got into the cancer center and started getting that experience, actually the same thing. So the HOPA core competency that was offered as part of the job, and so I took that. Very basic, I would say, but it does give a good foundational knowledge. I will give it that. And then from there, I was actually very lucky. So whenever I was transitioning to this new role and was going to be in oncology full time, Kelly Carlstrom actually reached out to me on LinkedIn and connected. And so it was like truly perfect timing. I don't know if she knew I was taking a new job. I haven't asked her that before, but truly perfect. And so obviously her program is the ELO Collaborative, and that's been like the biggest and the best resource to be a part of. And I don't know if you want me to elaborate on that or not, but
Well, Kayla, now is a good time to mention that this episode is sponsored by the ELO Collaborative, and ELO stands for Enjoy Learning Oncology. And this collaborative is designed for pharmacists working in oncology, especially those without formal residency training. And while you two do have formal residency training, you don't have PGY-2 oncology residency training, or those who feel that they've been thrown into the deep end without support. In your case, you two chose to jump into the deep end of oncology pharmacy. And this program includes a comprehensive curriculum with 24 courses covering all major cancers, updated regularly, live monthly case-based calls where pharmacists learn directly from experts in the field, a supportive community of pharmacists, and a oncology self-assessment snapshot to understand where your current gaps are, what you understand, and to come up with a plan to fill in those gaps and track your progress over time. So, Kayla, sounds like you had a good experience with ELO.
oh yeah, wonderful. And I'm actually still in it. So like, the goal, if you want, I mean, you can do it and join for a year if that gets you to where you want to be, or there's, like renewals essentially. And I've just stayed in it because I think it's such a valuable resource. And like I kind of mentioned in the beginning, I'm the only pharmacist in oncology in my health system. I'm the only one embedded in a medical oncology clinic. Like we only have the one medical oncology clinic. So I'm it. And, we are part of a larger health system. Like we're part of Trinity Health. And so I can get some, connection and resources from other, ministries within Trinity Health. But it always is so valuable to have, a network of other pharmacists in your specialty to go to and especially bounce those really crazy questions off of. So that's been helpful, but also just having the all the disease states, in one place to go back and refresh on, especially like, I'm not doing BMT in my day to day. But, if there's questions and obviously preparing for BCOP, et cetera, it's just a phenomenal course. Like, it's so well organized, so well laid out. Kelly has missed nothing, in my opinion.
Okay, that's wonderful, wonderful. Okay, so you're getting in the ELO course, you're getting some, you're getting pretty in depth probably on different subtypes of breast cancer treatment and some of the nuance of that and some of the common problems that trip people up. What were the biggest challenges you would say that you had in your role? You've got PGY1 training, you've got work experience working directly with oncologists and cancer patients. What's the biggest challenge that you've had to kind of overcome moving into your role?
Um, Gosh, probably a lot of different challenges along the way. It's kind of like what you were talking with Amber. It's just sort of we went in head first, it feels like, to our roles. And, like Amber, it sounds like she started a new role. I started a new role.
Yeah, I wanted to ask you guys both about there are actually so there's the Lexington Baptist and the Megan May connection, but you both have new roles too. And so not
Yeah.
only are you in, your pharmacy specialist in kind of a new milieu in oncology, but also with doctors and nurses who aren't used to having a pharmacist down the hall necessarily that they can talk to. So Amber, you probably, I mean, you had this experience, doing your PGY1 and then a PGY2 in AmCare. Did you have um uh any added experience starting a new practice or seeing a new practice started? I know your oncology preceptor, I think, maybe had started that practice. So were you able to learn anything from that you could take into your new position?
Yes, so she was a great resource for me. Her name is Paige Perez, that I was able to do the elective rotation with during my PGY1. So not only did I reach out to you when I accepted that first job in oncology, but I also reached out to Paige as well. She sent me a long email, gave me some different tips, tricks, just different ways to try to get new services going. So she gave great advice, along with your advice as well. But it was definitely challenging, especially the clinic nurses. They were used to providing all of the chemotherapy education at those two smaller cancer clinics. So it was really hard to try to get pharmacy services off the ground, get them to start depending on me a little bit more instead of the way that things had been before I started.
What was like an early success or early win that you felt like really helped establish you as like, all right, I'm the drug information expert here. I'm the person to go to for these hard things.
It took quite some time, I would say. So I started that job August of 2023. I didn't really feel like things were going all that well until probably the new year. So I would say probably January, February. I felt like the clinic nurses, they were calling me for more things, depending on me for more things. And I really just tried to advocate for myself. So I would search through the oncologists, schedule, look for any kind of new starts, potential new starts. And then I would try to ask the clinic nurse, hey, can I put together all of those educational handouts, get the consent ready for you? I'm happy to travel over to Georgetown if there's a new patient that day to educate, or over to Winchester if there's a new patient. So I think just trying to continually be available really made them start to call me more, rely on me more, and the infusion nurses as well for any kind of new drug questions. They really started to depend on me more, probably 4 or 5 months in.
Yeah, yeah, I would say similar to what I did, and sometimes you start to do good work, you become a victim of your own success, and then there's not enough time in the day to do all the good work that you're capable of. Kayla, what about you? So what did you learn from your PGY1? What skills did you get from that training experience that you're able to use to start your own practice?
I would say lots for my PGY1. It definitely gave a really good sounding board, as far as, learning to prepare, like obviously learning to prepare the presentations and learning how to precept and time manage and do multiple things throughout the year. It gave a good foundation for sure. there are, like when you decide to do a PGY1, part of that is deciding to work alongside a core group of preceptors for that year where you can get all sorts of knowledge from them. You're learning their precepting style. You're learning how they do their day-to-day work and how they get everything done. Because as you go in career, it just seems like you get busier and busier and busier as time goes on, and you become more valuable resource to your organization. And so you just learn all those little tidbits from them. So I think that's a huge part from a PGY1. And just, I guess, kind of also having the confidence that, okay, they can do it. I can do it. I can figure this out. If that makes sense.
Yeah, and I think one of the things maybe I hear you describing there is how to triage your day and what
Yes.
sort of stuff all right, I need this is going to take some time to figure out. So this I got to carve out some time in the afternoon to really do a deep dive on this. This is versus this is like there's a patient right now I got to go talk to because if I don't get to see them while they're here in clinic, it's going to be a whole lot harder to do this over the phone without that. Um,
Yep. Yep. Absolutely.
What about, and I'll start with Amber for this one. It's a similar question about what did you learn in residency, or where did you figure out how to teach yourself stuff really well? Because that's especially with how fast and how much change happens in oncology. What tricks did you learn from residency or elsewhere about, all right, how do I stay current on like knowing what is still right?
Yes, that's been huge in oncology, but I think that I first started to pick up some of those skills probably first year of residency, where it was an ambulatory care-based PGY1. We actually had a longitudinal period of the residency. So the first 6 months of residency, we rotated through a different clinic every single day of the week. So it was primary care one day, geriatrics clinic one day, transitions of care, endocrinology. So we were constantly doing something different. And so I really had to kind of shift gears of, okay, on Tuesdays, we're focused only on diabetes, endocrinology, but tomorrow I have to be prepared for all of my anticoagulation patients. So I think kind of having those different gears, that really helped in terms of I have to have this wide array of knowledge, but I have to know, when to kind of tap into those different resources. But I've tried to use a lot of those skills going into oncology because, like you mentioned, it's an ever changing field. So that made things even more daunting of trying to get this knowledge base without having a PGY2 in oncology. But as soon as I learned something about breast cancer, it seems like 2 months later it changes or there's something new drug approvals. So really trying to stay up to date with all kinds of new information, whether that's new drug approvals, reviewing NCCN guidelines. But it seems like there's new things every single day, so it can be a challenge.
All right, here's the litmus test, Amber. All right, so there's some new guidelines that come out on, say, I don't know, some AmCare topic, the blood hypertension, type 2 diabetes. Do you get excited for that the same way I get excited for a new drug approval, like a brand new like a new pharmacologic agent? Do you still have that love of like all the ambulatory care disease states?
I have to say it has dimmed a little bit over the past couple of years, but I am still very passionate about diabetes. So if I see certain diabetes medications on my patient's medication list, even now in oncology, it kind of hurts my heart that I'm not educating them about that or counseling them about hypoglycemia, proper insulin techniques. So I do still have that love in my heart, but it has dimmed quite
Yeah. All
significantly.
right, I'll talk about the former part to Rick Hess, but not the latter part. And that's I'm sure a huge benefit because so much of oncology pharmacy now is ambulatory care related. Um, so Kayla, what about you? You're still in the ELO Collaborative, and OncoPharm listeners can click on a unique link in the show notes here for access to that course, and some of those proceeds come back to support the podcast. So you still have some of this ongoing help staying current. What else did you learn from residency or from other mentors about how to stay current on everything new that's happening in oncology?
Yeah, I mean, I think the answer that a lot of folks give is, signing up for various listservs and things for when new drugs come out, when guidelines are updated, et cetera. I've gone in waves with all of that, truthfully. I I still get like the flash updates from NCCN, but I've learned to scan them. And I've learned to, okay, like what's applicable in my practice right now versus what are like BMT updates that like those are not my day to day, and I have to triage, right? Like everything is triaging in my world, truthfully. But yeah, so some of it is definitely still the emails, like there are things that I get excited about. And if it's a, breast, lung, colon, if it has to do with the biggies, which we're treating day in and day out, like that's exciting. I'm like, okay, what's changing? But aside from that, honestly, LinkedIn is super helpful. There are just a lot of great people that post on there, and they are, I don't know, there's just some really good people that will do like little reviews of new stuff that's come out, and it just makes it more digestible. So honestly, I'm on there quite a lot. I tried Twitter or X for a hot minute, but that was way too overwhelming. I was like, this is too much for me.
You're not the first person to mention LinkedIn. And about 10 years ago, Twitter was a pretty good place to kind of stay to current on new stuff that came out. There are a lot of like mavens who would be like, "Oh, this is my myeloma person. This is my lung cancer person. If they say it, I know that I need to go look at this." And it sounds like maybe LinkedIn has occupied that space. I have not got into LinkedIn because I'm old. I'm a Luddite. I just can't take on another social media platform. Going in depth. So I kind of cut you off there as you're talking about LinkedIn, though.
No, I mean, I would just say, I think it is a good one. That's honestly where I've picked up a lot of different nuggets or new drug approvals or big changes that have happened. So I definitely, I'm not on there like every single day, but I do periodically check that. And then, yeah, I mean, the ELO Collaborative is also great. People will post in there, new changes, new updates, and things that are coming on, or just like fun articles pertaining to oncology. Like Kelly and Joe wrote an article together, just about like oncology pharmacists in practice. And sometimes it's just, there's a lot of ways to stay up to date, but I would say those and getting the emails or LinkedIn, getting the little nuggets of what's happening and what's changing, and then you can go find it. Then you can go back to the source. Then you can go to ASCO, NCCN, wherever, and look at the guideline yourself and see what actually changed.
Yeah. Okay. As we kind of wrap up here, for the episode I did about folks who kind of knew they were going to do PGY-1, PGY-2 in oncology and go be oncology pharmacists. I kind of use the analogy of that's like a planned city, where all right, everything the grid is all planned out. We know everything. We'll talk about in the PGY-NONE episode the kind of dandelion effect of people who just they don't really know where their career is going to go, but they wind up in the place that they're supposed to be. And you guys are kind of like the road trip. You knew you were going to do residency. You go on and you didn't really know where it was going to go, or you maybe for an Amber's case, you had an idea of where it was going to go, but you were not afraid to take the scenic route when you got interested. And that's kind of how every good road trip is. You're like, all right, I know I'm leaving this tiny Dust Bowl town behind, and I'm going to find, greener grass somewhere else. So, Amber, what would be your advice for someone who's starting on their road trip and they're like, all right, I'm not going to do a PGY-2. Maybe I'm not going to do residency training, but I think I want to do oncology pharmacy. What would your advice be to that person to get themselves ready for this type of position? Because this was you a few years ago. So what would your advice to be, maybe to your old self or to another student or maybe someone who's finishing PGY-1 or thinking, do I want to do a PGY-2 oncology or just go straight into the grown-up workforce?
I would say just be open to the journey. I know that sounds a little bit cliche, but I have so many moments now at work or whenever I'm leaving work if I truly feel like I'm where I'm supposed to be. I have great colleagues around me that I can bounce questions off whenever difficult things come up or I'm needing help with a question. They're always available to lend a helping hand. But I just truly think trying to not have everything so mapped out. Just be open to where your career takes you. Because, 5, 6 years ago, I couldn't have imagined that this is where I would be, but I'm very grateful. My patients, they mean so much to me. And I do feel like I'm making a difference. And so that's not something that I truly felt during my PGY2 and ambulatory care. Sometimes you don't always feel like you're making a difference talking about diabetes, anticoagulation, but for patients that are going through cancer, you can really have a huge impact as a pharmacist and make a difference in their whole entire journey. So I think any opportunities that you have to learn more in oncology, to shadow an oncology pharmacist, to see truly the impact you can have, I don't think that it's something that you would regret.
Yeah, agree. All right, Kayla, what would your advice be for road trippers thinking of maybe going getting off the interstate and going into an oncology clinic?
So I would say if you have any inclination that you want to be around a hospital or a clinic setting, I would recommend highly considering a PGY1, whether it's hospital based or health system based or more ambulatory care focused. I do think that it just helps so much. And I think that later on down the road, like I think of the position that I'm in now, and I don't know that I would have gotten this without a PGY1. I don't know that I would have had the opportunity to build a new position from the ground up without those skill sets from a PGY1. So those are some things to consider. But, I definitely know there's so many people in oncology that didn't do a PGY1 at all. And from that standpoint, I think if you're interested, then find those avenues to, get in the door, whether that's working at a specialty pharmacy that primarily dispenses oncology meds, and you get your foot in the door that way. Or, you take a job at an infusion center if there's openings and, they like you and the personalities jive. But I think that if you have some sort of desire to be in a hospital or be around oncology, I would strongly recommend a PGY1 just to make things move along faster. If you're dead set on PG, or if you're dead set on oncology, then do a PGY2 for sure. Or else it might be a very windy journey trying to get there, because you just never know what's going to open and when. But like Amber said, at the same time, enjoy the ride and enjoy the opportunities that come available to you.
Yeah, and there are lots of positions open. Oncology pharmacies are very sought after. Our oncology pharmacists are very sought after clinicians. So just apply for a job if you're thinking of it. And if you don't get it, say, what would you want to see on my CV before you did this? And people are like, well, we would love to hire some people. We're having trouble keeping folks here in our clinic and hospital. So I would say, just keep putting your foot out there and keep trying to get experience like Amber and Kayla said. So Amber, Kayla, thank you so much for joining me and dealing with the Wi-Fi here in Johnson City going out for a little bit during this episode. And Kayla, you connect with Kayla on LinkedIn and see who she follows and for the updates that she has found useful. That's kind of how I did it in the early days of Twitter, is like if I saw somebody that was talking all the time about their food, I'm like, oh, this is not what I'm here for. But if they like posted something once a week and it was like really useful, I was like, okay, this is the type of thing I'm here for, and I'll follow this person. So again, thanks, Amber. Thanks, Kayla.
Thank you. Thanks for having us.
Yes, thank you.